Hello and good morning, dear viewers. You're most welcome to the DAKTARI program. And this is a health educative show which airs on National TV every Thursday from 11 to noon. And we bring you people in the medical field who come to educate you, the viewers, matters regarding your health. Yet today, we have an exciting topic for you. It will be from the field of reproductive health. Though often people think when we talk about sexual reproductive health, we are going into matters regarding conception and maybe family planning measures. No, not that mainly. We have other classifications which fall under sexual reproductive health, like the sexual transmitted infections. Today, that will be our topical discussion regarding sexual transmitted infections. However, before we go deep into the discussion, let's first get our guest introduce herself, then we pick on.
Good morning, our viewers. This is Dr. Navka Mastola Masi from Oak Diagnostic Center. I'm happy to be back with yet another episode on sexually transmitted diseases. Oak Diagnostic Center is a medical diagnostic facility that is located in the heart of the city, Aroa City. We are located on Hospital Road, and we provide a range of diagnostic services, both lab and imaging, and we also provide wellness checks. And I'm happy to also inform our viewers that in regards to the subject matter that we're going to be talking about, we also have a range of services that we provide in testing for sexually transmitted diseases. I'm actually excited for this particular session. Thank you.
Thank you to Dr. Mercy. We don't take it for granted. You are again giving in your time to come and educate the viewers of Westernal TV. The session we had before, I think, was last month, but one was exciting, and the viewers appreciated. And also, we know this one will be exciting too for the viewers, since it's also regarding sexually related things. It will be exciting for the viewers to take home. Okay, yes, our viewers, let's pick on our topic of discussion related on sexually transmitted infections, and we would love doctor to first let us know what are sexually transmitted infections. Is it the way we perceive it? Because sexual transmitted, is it mainly we are going to acquire it mainly through sexual intercourse, or you could be having a detailed discussion for that?
Okay, talking about sexually transmitted diseases, I just want to say I think the name is very, it is self-explanatory. They are diseases that are moved from one person to another through sexual intercourse. However, I think as we discuss later on, we'll realize that currently there are different types of sexual styles that people are using, and you'll find that it is not just about the genitals, because when we talk about the reproductive system, the first thing that comes into our mind for the women, it's the vagina, and for the men, it is the penis. But we will be digging deep into some of the other modes or sexual modes that people have adopted in the current times. So I think that's what I have to say about sexually transmitted diseases. However, we'll also note as we discuss that some of the infections that we see here are not only transmitted sexually, but you can have them transmitted through mother to child transmission at the point of giving birth, or it can be mixing of body fluids, especially for the viral infections. Yeah.
You have told us because many people thought it could be gotten through maybe interaction sexually, maybe the man meeting the woman, vagina and penile intercourse, but you have told us it comes also depending on the various modes people could be playing it up. And also we have often, actually, even the viewers, I know they are already puzzled. We are talking about sexual transmitted infections. However, again, we hear in the same you people in the hospitals or in the facilities telling us urinary tract infections, STI and UTI. What is the difference between these two? Because often they are confusing us and we don't know how we could separate. because someone could be having a UTI and maybe they presume they have an STI, or maybe they could be having an STI and they presume it's a UTI. Kindly clear for us that confusion.
Thank you, Sandy, for that question. And it's really a justified question because, in my experience, I have encountered it many times. And at this particular point, we want to kind of try to clear the air and create a clear distinction between these two types of infections. So, like we said, sexually transmitted diseases affect the sexual reproductive system. And the sexual reproductive system, very quickly, in women, we have the ovaries, we have the fallopian tubes, we have the uterus, we have the cervix, and then we have the vagina. Then for men, we still have we have the penis, we have the urethra, we have the epididymis, we have the scrotum. So we have those different parts. Now, sexually transmitted diseases will basically affect the reproductive system of either the man or the woman. Then when we talk about the UTIs, the urinary tract infections, for them, what happens is that when they will affect the urinary system, and the urinary system encompasses the kidneys, the ureters of the kidneys, the urinary bladder, and that is the system that we are looking at. But where does the confusion come in from? Now, in the female, the urethra, where the urine passes, is at the point of the clitoris, which is within the vagina. So what it means is that if there is any sort of inflammation around the vagina and the clitoris, so as the urine is coming out, you will definitely feel pain. But this infection is coming from maybe a sexually transmitted diseases and has caused that particular area to get inflamed. So as you pass urine, you start feeling pain because of the inflammation that is around the area of the clitoris and the vagina. But for the men, remember that the urethra passes through the penis. So it means that if there is inflammation within the urethra, you will definitely feel pain, and therefore it may be very disturbing to distinguish between a UTI and a sexually transmitted diseases. So I believe that is where the confusion comes from. But these are two separate systems. UTIs are not sexually transmitted, so people should understand that. Yeah, so I think that's what I have to say.
Thank you very much, Dr. Mercy. Indeed, you have made it clear for us that these are two various systems being affected, where the UTI affects the urinary system and the sexual STIs affect the reproductive system. Okay, then also often we have another confusion in the community. People often get these, let me say, it's absurd to say it, but of recent they are saying there are many UTIs, or let me say STIs here in Arua. And people also often get these for us we call it candida, though you guys call it candidiasis. And they confuse it to be an STI. Or maybe okay, let me say it could never know, it could be a UTI. But how true is it that a candida is an STI? Because often people in the community confuse it. When they get it, they think maybe it's with a woman, she may think maybe it was transmitted to her by the man. How could you clear that air off?
Well, yeah, actually, now that's also another myth that we want to clear. Vaginal candidiasis is not a sexually transmitted disease because, like we said, it's vaginal candidiasis. And how does it come about? Let me just quickly get into that for people to understand this. In the vagina, we have what we call Candida albicans, and it is part of the normal flora for the female reproductive system that is within the vagina. So when someone gets candidiasis, it means that there is an overgrowth of that normal flora. Now, it ceases to be normal flora is useful bacteria, in the layman's language, it's useful bacteria. So it overgrows, and now when it overgrows, it ceases to be useful bacteria. Now useful yeast. It's not useful bacteria, but it's useful yeast or fungus, and it ceases to be useful anymore. Now it becomes harmful or pathogenic, and you get what we call the candidiasis. And now, because it is because of the yeast that is within the vagina of a woman, there is no way it is going to be transmitted sexually. So, and a man does not have a vagina, a man has a penis. So, candida is not sexually transmitted. And I believe that our viewers from today onwards, they will stop confusing candidiasis with the sexually transmitted diseases, because fungus or yeast is not sexually transmitted.
Indeed, this session is like, let me say, I was illiterate. I didn't know. So through the discussion, also I believe the viewers, they are getting to understand and putting off this confusion of maybe combining candida, taking it to be a sexually transmitted infection. Then let's zero down to today's topical discussion about sexually transmitted infections. You have already given us an overview of what a sexually transmitted infection is. However, we would love to know, do these sexually transmitted infections have classes? And also, maybe before you classify for us, are there maybe are they more common in females or more common in males?
Um, in terms of being common, because they are sexually transmitted, so a number of times, usually the statistics, female normally have higher statistics in terms of these transmissions compared to the men. And but like we said, it is sexually transmitted, so you have a man and a woman in this mode of transmission. Now, going into the classification of the sexually transmitted diseases, I would say that we broadly classify them, I think, in three categories. We have the bacteria or bacterial. So it means that for this category, it is bacteria that causes the disease. Then we have parasites, as we shall get the details, and then we have viruses. So going into details of, because we can't list, of course, there are very many bacteria, but we are going to talk about the common bacterias that cause sexually transmitted infections or diseases. Number one is what we call syphilis. Most of us know syphilis. We've heard about syphilis, and syphilis is caused by a bacteria which we call Treponema pallidum. So that is syphilis. Then still under the bacterial infections, we have gonorrhea, which is also common. People know it. In Lugbara, honestly, I don't know how they call them, because in my language we have names for them. So, but I'm not very sure about the Lugbara versions of these diseases. Yeah. So we have gonorrhea, and it is caused by a bacteria called gonorrhea neisserii. That's the bacteria that causes gonorrhea. Then the other bacterial infection that we have is the chlamydia. And chlamydia is caused by Chlamydia trachomatis. That is the bacteria that causes it. So then we have others which are not, those ones are the common ones, especially here in Uganda. But there are other bacterias, the Haemophilus, there are many, but we are focusing on the common ones. Then for the parasites, the commonest parasite is the Trichomatis vaginalis, which is very common in women. And then when we go to the viruses, number one, we have, of course, HIV. we know that HIV is sexually transmitted. We have hepatitis, which we previously talked about. It is also sexually transmitted. We have herpes simplex. It is sexually transmitted and it mainly moves along the nerves. And then we also have the human papilloma virus. So those are the most common viral STIs. However, there are others, but we want to focus on the common ones.
Thank you very much, Dr. Mercy, for indeed giving in the classification. And also, I believe the viewers have gotten to note these sexual transmitted infections. Never know, most thought they are bacterial and they only know syphilis. However, she has told us people even didn't know maybe HIV is a sexual transmitted infection, but they just took it as a block HIV. But I believe the viewers have gotten to note on these various types of these sexually transmitted infections. However, doctor, before we zero down again to bacterial STIs or sexually transmitted infections, could you smear something on the viral sexually transmitted infections?
Okay, so for the viral sexually transmitted diseases, like I said, okay, HIV really, there's so much that has been discussed around HIV. I wouldn't really want to go into it, but we know that it is sexually transmitted. But currently, there's so much interventions that have been put in place to curb its transmission. And those days, the early years in the 1990s, we had AIDS, that clearly defined what HIV was. But in the recent currently, people they are symptomatic. You can't even tell that they really have HIV unless they do the HIV test. Then I'll go to hepatitis. We also talked about hepatitis in our last session that we had. Yeah, it is sexually transmitted, and we said that this one mainly affects the liver. So it is important that we are aware of hepatitis. The two viral infections I want to spend some time on are, number one, the human papilloma virus. So we have the human papilloma virus, and the human papilloma virus has got a number of types. There are many types. There are different types of the human papilloma virus, but there's a type that specifically causes what we call the genital warts. And the genital warts, of course, they affect the either the vagina or the penis. And in description, I don't even know how to describe it, but it causes an appearance which looks like a pineapple. That overgrowth. When you look at the picture of a pineapple, the growth is like that. And for the men, you'll mainly see that growth around from the head of the penis. Before you go on to the body of the penis, there is that border. So around that border, you see those things growing around that particular area. That's why they always recommend men to go for circumcision. It helps with even some of those. Then for the herpes simplex virus, it is sexually transmitted, but then if there are people who engage in oral sex, they can actually also get herpes on their lips. And it is important we understand, like we said, that so people who engage in oral sex, they can get some these kinds of infection. And then herpes simplex, what we have to understand about herpes simplex is that it can be dormant, but then when your immune system is down, because it moves along the nerves, when you get it, then it kind of settles in the nerves. So when your immune system is down, you can get the symptoms again, and you can still have herpes simplex of the lips without engaging in oral sex, but it can be because you probably had a previous exposure to that herpes infection. And that's why some people say when they get those rashes on the mouth, they say that they have malaria. but it is because the immune system has come down, so you have the herpes infection around your lips. Yeah, but the moment your immune system is up and running, then it clears.
Thank you very much, Doctor, and for clearing the air. We have seen often people getting, yes, those outgrowths on the mouth. Some have been lying to us that it's malaria. So we have come to understand, never know, it could have been a sexually transmitted infection. Also, as we zero down to our topic of discussion today, we go to the bacterial sexually transmitted infections. You gave us examples of syphilis, you gave us examples of gonorrhea and chlamydia. We would love to know, how can these, how can someone acquire these bacterial sexually transmitted infections? Then also, if you could, okay, classify, maybe never know if each could be having a different mode of transmission. Never know it is general. Thank you.
Okay, for the bacteria, the main primary source of transmission or mode of transmission is the sexually transmitted mode. So it means that two adults are engaging in sexual intercourse. If one is infected, then they transmit the bacteria to the other person. So it means that there will always be, you pick it from somewhere, you give it to another person, and the other person gives it to another person. And that's why we normally recommend that people should be faithful to their partners, because that's how it's being spread. Now, that is the primary, but we also have a secondary mode of transmission, like we talked about, which is mother to child. So, for example, for syphilis and for gonorrhea, it can be transmitted from a mother who has got this sexually transmitted infection and it is not treated during their antenatal. So it means that at the point that they are giving birth, it is possible that as the child, remember that is the birth canal. So as the baby is going through the birth canal, they can easily pick syphilis and they can also pick gonorrhea. So you'll find that there are babies that can be born with syphilis or they can be born with gonorrhea if the mother was not treated or was not screened during her antenatal. Yeah, so and yeah, I think that's what I can really talk about when it comes to the actual modes of transmission for those for the bacterial sexually transmitted infections.
Thank you very much, Dr. Mercy. And also, maybe I'd love to know, you have told us these bacterial sexual STIs can be transmitted through the birth canal, maybe in the process of a woman delivering to a baby. Is it the reason why we have seen often in the new trends, when these mothers go for antenatal visits, they are told to test for these maybe syphilis and also HIV?
Yes, that is the reason why we tell mothers that they should screen, because of course when a woman is pregnant, it doesn't stop them from having intercourse with their husband. And so we want to make sure that in every trimester, right from first trimester, second trimester, third trimester, we continuously screen for these infections, to make sure that if the mother has it, we immediately treat that infection. But even sometimes in the first trimester, if it's not treated, any infection can be a threat to the pregnancy. The mother can easily have an abortion because of these sexually transmitted diseases. So that's why we are very keen at screening them and making sure that we manage and treat them immediately when we pick these sexually transmitted infections.
Thank you very much, Dr. Mercy. And also, I believe now our viewers, you have gotten to know, if you're pregnant, you should know the use of these antenatal care visits. Please go test out and confirm. Never know, if you are positive, you start treatment early, such that you shouldn't transmit these infections to your children. However, I would love to know, Dr. Mercy, if maybe they are in the process of delivery, the mother had maybe a bacterial STI, like maybe syphilis. Could this infection, like, okay, we have said it could be passed on to the child. can this child live long with this infection, or also maybe if we manage the child, it could also maybe heal?
Yeah, if the child, because at that point, if we notice that, I know that when the mother is going to give birth and the midwives are doing or the doctor is doing a vaginal examination, you can tell, because when you look at how the vaginal fluid is, the smell and everything, you can have a telltale and get to know that, hey, this mother could be having gonorrhea. Or if you see ulcers around the genitalia, it will tell you that this mother probably has a sexually transmitted disease. So as a clinician or someone who is attending to this mom, you have to make sure that immediately the baby is delivered, you will start them on antibiotics to make sure that they are treated, and you also treat the mother. And normally for gonorrhea, when those babies come out, and even chlamydia, because chlamydia trachomatis, it also affects the eyes. So you will see that those are babies that normally seem to be having pus, pus that is coming out of the eyes, but usually that is one of the signs that the mother could have had gonorrhea during her pregnancy and transmitted it to the child. So immediately the clinicians will pick this and start the child on treatment. Syphilis, yes, if it is treated early, but of course we know that if it is not picked early, it has different stages that it goes through, not only for the mother, but even for the adults, because we have primary syphilis, we have secondary syphilis, and then we have tertiary syphilis. So you find that the primary syphilis, the symptoms will appear within 21 days of contacting, like, I mean, if you get the infection from another person. And then for secondary syphilis, it can even come between 4 to 10 weeks after. And then for the tertiary, it can even come after. That's what they call latent. Someone can have it, it's in there, and the symptoms can appear after even 3 years. So, but that's why it's important that it is key you screen and you treat to make sure that the bacteria, the infection is completely treated. So yes, it is very treatable.
Thank you very much, Dr. Mercy, for clarifying that. And also the mothers, in case you had maybe an STI and you happen to deliver, still your child could be treated and they heal. And those who have just joined us, we are yet going for a short commercial break, and we'll be back in the next segment where doctor will take us through the signs and symptoms you could present with in case you have sexually transmitted infections. Let's get back. Thank you.
West Nile TV, lighting up the region. Jude Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, a team of dreams!
Catch all 380 games live and in HD on Sports Premium Channel 259 and Channel 246 starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and limited passion.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. And those who have just joined in, still the DAKTARI program, which airs on West Nile TV every Thursday from 11 a.m. to noon. And today our topic of discussion is regarding to sexually transmitted infections, where in the first segment, Dr. Mercy from Oak Diagnostic told us these infections which are transmitted mainly through intercourse, those sexual intercourse. However, she also told us it could be depending on the various modes. You know, now people also do the oral sex, also you could get these infections through those various modes. Then also she clarified for us, often people in the community, we cannot distinguish between a UTI and an STI. She told us how we could separate these since they affect two different body systems. And also now in this segment, she's going to take us through the signs and symptoms you could present with to know that you have an STI, and you get to understand maybe if you have any of those, you rush to the nearest facility or clinic to be tested, then you start treatment. We'll be back from that short commercial break. Dr. Mercy, you will pick on with the signs and symptoms. Thank you.
Happy to be back. Yeah, so we are going to briefly go through the signs and symptoms for sexually transmitted diseases. And of course, in Uganda currently, we do a lot of the syndromic approach. So syndromic means that we need to understand how these infections present to give us a clue of whether this is a sexually transmitted disease or not. So first, I'm going to start with what we call, in the medical term, it's genital ulcers, but we can call it wounds. You know, you can have those wounds around your private parts. For the men, around the head of the penis. For the women, around the vaginal area. So when you have those wounds or ulcers around your vagina or your penis, it's an indication that you could be having a sexually transmitted disease. And from the types that the different bacteria or infectious organisms we talked about, the culprit for the biggest, the syphilis is one that commonly presents with an ulcer, especially the primary one that we talked about. And usually that ulcer may not be painful, and actually a number of times it is not painful. But when you see it there, then you will know that I could probably be having syphilis. Then another one that could give you genital ulcers could be herpes, you know, because they start as small blisters which have water in them, and then they burst, and then eventually they create wounds around the genital organs. So that is another organisms that can cause ulcers around the genital area. Others, the ulcers may come as a result, or the wound, because some of them cause that place to be itching, especially for women. It can be itching, and you're scratching, because you're scratching and the place is very sensitive, the skin is thin, you create wounds around that place, and then you end up having those ulcers. Now, for some women, by the way, did you know that for those who have vaginal candidiasis, it is really itchy? You know, very, very itchy. For the women, they know this, that every time you want to run and scratch, they scratch and scratch, and they end up getting what? Wounds. So you might have the wounds as a result of the itchy presentation, and then when you find out, you find that it's probably candidiasis, but because you've scratched the place, you've created wounds around the place. So we just have to make sure that we distinguish. Doesn't mean that every ulcer you get there could be as a result of what? Of syphilis or herpes, but those are the commonest that give us ulcers. Then the other one is a discharge. A discharge. For women, we call it a vaginal discharge. For men, we call it a urethral discharge. And for women, normally we are supposed to have a discharge. you know, because the system, it cleans itself, you know, you have mucus that is being produced from your vagina, so it is normal to have a discharge. But you can have an abnormal discharge. Did you know that, Andy? Oh, you didn't know that. Here we have abnormal discharges, and we need to distinguish what is normal and what is abnormal. And then even for the women, during our different stages of the menstrual cycle, you know, you can be approaching your ovulation, during ovulation, immediately after your periods, you know, the discharges are different, but they are normal. You're getting it? So you find that as you're approaching ovulation, your discharge is very thin and very transparent. But it is not smelly, it doesn't smell. Then at a certain point, it is very thick, thick like mucus, you know, which is coming out. And then at a certain point, immediately after your periods, you find that it's a little bloody, because you're just finishing your what? You're just finishing your periods, and then it might be smelling, depending on, a little smelly, like the blood smell, because you're concluding with your periods. So we need to distinguish the normal discharges from the abnormal. When I talk about the abnormal, number one, you yourself, when you remove your panty, you say, this thing is smelling. Then there is that common one which smells like fish. Someone might even think that you're from eating fish, but that is the Trichomonas vaginalis gives that fishy smell, and a number of times it's green. You know, it is green when you look at your panty. Then others, it could be yellowish pus like, you know, that is not normal. Then if you don't expect periods, and then you're seeing a bloody discharge in between, it could be that you could have a sexually transmitted disease. Then the other form of discharge that I want to also just hit on is the candidiasis discharge. That one is very distinct. It looks like milk, spoilt milk. For some of us who have seen spoilt milk, it is whitish and it looks as if it is spoilt milk. So that one is now it indicates more to vaginal candidiasis. Now, the other symptom that we have for sexually transmitted diseases is painful sex. So because that place, any microorganism, when it goes into a place, remember last time we said it causes inflammation, you know, because the body is trying to fight, so there is inflammation. So whereas there is inflammation, there will always be what? Pain. So if you're trying to have intercourse with your partner and you have a sexually transmitted disease, you could have pain. Then even for some of them, you can even have some bleeding as you're having sex, because the place is inflamed. Yeah. Then the other symptom that we have are what we call the genital warts. We've talked about them for the herpes, for the human papilloma virus. You know, it looks like how the pineapple is. You know how the pineapple things are structured, especially the upper part. Leave alone the lower part, the upper green part that we hold. The way it is structured, it's how those growths happen within the genital areas. And then we also have low abdominal pain. You can have both for men and women. You can come to the hospital because remember we said it affects the reproductive system, and we can't see the ovaries, we can't see the tubes. But because there's an infection and they are inflamed, someone can present with lower abdominal pain. Lower, not upper. Lower, because the reproductive organs are in the lower part of the what? Of the abdomen. Yeah. Then maybe the other thing I would want to point to for men, especially with gonorrhea. You know, women sometimes gonorrhea may not be very, very specific. You might not even tell the discharge. But for men, you clearly see pus coming through your what? Your urethra. And it is really very painful. I know gonorrhea is really very painful for men, and they can easily tell that they actually have gonorrhea. Lastly, what I want to talk about is we said that we can have transmission during birth. So congenital syphilis, like in children, So you'll find for some of them their eyes might be affected. So they have red eyes, they have some sort of like pus like discharge that is coming out of their eyes, and then others might have an enlarged spleen and liver, because that's what it could do to the baby. And then also congenital syphilis or syphilis that is obtained during pregnancy or during birth can also affect the bones, the growth, the bones of the children. And normally we can see this from the teeth. You know, the dentists or the dental surgeons can tell that someone has, you know, your teeth are weak, they have a brownish line around them or a line that goes through them. They will tell that actually this person had congenital syphilis that affected the growth of their bones, including the teeth. Then you can also have those non-specific symptoms like fever, you can have a rash, and then we also talked about for syphilis, tertiary syphilis, you know that it mainly affects the nervous system. Yeah, so some people you can get convulsions because of what? Of syphilis. Yeah, you can have that generalized rash all over your body because of syphilis, and some people may think maybe it's a fungal infection. So that's why it's key that you screen. You can have a rash on your skin and you think that, oh, maybe I touched something, or but when it is a sexually transmitted disease that is expressing itself through the skin, and you then need to screen and test and say, could this be a sexually transmitted disease? And you don't just say, let me buy a tube and, you know, clear my skin. No, you treat the sexually transmitted infection. I think in a nutshell, those are really the commonest signs and symptoms.
Thank you very much, Dr. Mercy. Indeed, you have given us a detailed form of these signs and symptoms. And in case our esteemed viewers happen to get any of these signs, maybe lower abdominal pain, maybe painful sexual intercourse, or maybe the discharges, please, you could rush to the nearest facility for treatment. Now, maybe, Doctor, again, I come back to you. We have a patient has presented with some of the signs and symptoms you gave us previously, and they have come maybe to a health facility. What do you guys do to confirm? Maybe if they have come maybe to OC, what do you always do to confirm this?
Thank you. So normally we have what we call screening tests. Let me just quickly go through the viral. We have HIV. You know, we can test for HIV. We do the pap smear. We can do a vaginal exam and pick a sample. Then hepatitis, we do the hepatitis screening, hepatitis B surface antigen. We can do that. And then also hepatitis C. When we come to the bacteria, for syphilis, we have a blood test that we do. Commonly, especially in this place, we do what we call the TPHA, which is Troponema pallidum agglutination test, to test and see if you pick like the antigens for the syphilis. Now, these other ones, the chlamydia, the trichomonas, the test that we normally do, which is specific for us to be able to pick those various organisms at one, we do what we call a high vaginal swab. So in the high vaginal swab, what we do is that we go around the upper areas, the upper end of the vagina, and we pick a sample. And then for the men, we do what we call a urethral swab. So we insert something and then we pick a sample from the urethra to be able to get that fluid. And then when we get it, we test it. And there is what we call we have the gram stain. We'll be able to, the different bacteria have different presentations, and even the parasitic infections. So we'll be able to know that this is gonorrhea, this is syphilis, this is, you know, we have those different tests that we do. Then the ultimate, and currently we advise culture. So because now you see, we say the vagina also has other bacteria, which we call normal bacteria. It has normal bacteria and normal fungus, and it's useful to preserve that area. So when we are picking the sample, it doesn't isolate and say, no, we are on it. No, it picks everything, including the normal flora around that area. So when you do a culture, you're able to know that this is normal bacteria. We even quantify it and say, okay, it is normal, and it's also within normal ranges, so this is okay. But it can be normal, and then when we quantify it, it's high, and then we know that now it has ceased to be useful bacteria. Now it's probably causing problems. And then we also, culture means that we grow. So we shall go to the lab, put the sample on certain media plates, and then we start growing and see which bacteria is growing. Is it gonorrhea? Is it, and if it's gonorrhea, which species? You know, we go up to the details of species, and then we are able to tell you, hey, you have gonorrhea, or you have chlamydia. So that's how, those are really the tests that are recommended when it comes to sexually transmitted diseases. So really, a culture is key for you to isolate them and be able to tell this is the particular bacteria that is causing problems.
Thank you very much, Dr. Mercy, for letting the viewers know some of the tests they could do when they come maybe to the health facilities. However, we would love you to also educate or maybe let the viewers know, how do you guys always manage these sexually transmitted infections, specifically these bacterial ones?
Okay, for the bacterial sexually transmitted diseases, I want to say that according to the Uganda clinical guidelines, we've been following an approach which we call the syndromic approach of management, where we have different 3 categories of antibiotics that are put together to be able to target, the different organisms. However, currently we are seeing a lot of resistance to the current antibiotics that we have. You find that someone is going to come, you put them on the combination of ciprofloxacin, doxycycline, and metronidazole, but then they don't improve. So it means that we've seen the rate of resistance to antibiotics is increasing day by day. So what are we proposing currently? If most regional referral hospitals have microbiology labs, and then there are also microbiology labs that are private. So if a doctor recommends and tells you, please go and do a culture and sensitivity test, please don't look at the money. Just because it's going to help. What the culture and sensitivity test does is that they grow, like I told you, they will grow the bacteria, and then after growing the bacteria, they are going to test it against the available antibiotics, and then we'll give you a report and tell you, according to the sexually transmitted bacterial infection you have, maybe metronidazole will not work for you, or ciprofloxacin is not going to work for you, or cefixime is not going to work for you, but tetracycline will work for you. So now that means that you don't waste time taking drugs that are not working. But I also want to say, because of the resistance that we are seeing on antibiotics, people are transmitting resistant strains. You might find that you might have gonorrhea, and your gonorrhea does not respond to the azithromycin, it doesn't respond to cipro or cefixime. Now, when you transmit it to me, it means that even if I've not had a sexually transmitted disease before, and this is my first time, because it's resistant already to those drugs, if I take them, I am not going to heal. So it means that really, because of resistance to antibiotics, it's important for now. We recommend that people do culture and sensitivity for them to be helped to understand which antibiotics will work for them. And so I think that's how I can wrap it up for the treatment.
Hope the viewers have gotten to know the treatment measures. However, she told us, please, if they ask for culture sensitivity test, please let's go for that, because they could help you know whether the cause of the infection, or maybe let me say the bacteria is resistant or not resistant, and this in the long run can help you save economically, other than spending on your monies on drugs which could not be effective to treat your infection. Then also, doctor, how can the viewers outside there keep themselves safe and their families safe from acquiring these sexually transmitted infections, specifically the bacteria?
Yeah, now I'm going to go back to the strategy. I know these days we no longer have that campaign, but in the early years, for us as we were growing up, we had the ABC campaign. And the ABC campaign is what works, is the prevention approach for sexually transmitted diseases. Number one, if you're not within the age bracket of getting married, please abstain. If you're married, please be faithful to your what? To your partner. And then if you can't wait, if you can't abstain, use protection and use a condom. Then I would also want to say there's something I missed out on treatment, that when we are treating people with sexually transmitted diseases, we don't treat one partner. So when we treat you, we also tell you to bring your partner and we treat them. Because if we treat you and your partner is not treated, you're going to heal and your partner is going to transmit to you again. So for married couples or people who are in relationships, we have to always treat the partner, because some people, they complain, they're like, why do you want my partner? This is intruding in my privacy. Or especially men, they don't want to take medicine. You know, the women are treated, for them they refuse to take the medicine, and then the consequences, it's the women who are constantly treating themselves. So we are asking and requesting, especially male partners, please accept to be treated. If you find that your wife has been diagnosed with a sexually transmitted disease, accept and both of you are treated to avoid recurrent infection amongst yourselves.
Thank you very much, doctor. Indeed, the viewers have gotten to know, for us men, we call it alpha male. So when you are, maybe the lady is sick, they don't want to attend in and also get treatment. Yet, also if maybe the lady treats, the man could be harboring this bacteria again and transmit it to the lady. Thank you very much, doctor, for that clarification. However, as we're almost coming to the conclusion, what are some of the complications the viewers could get if they poorly manage these sexually transmitted infections? Because also I know one, you'll clarify on it. I don't know whether it's a myth that if a man doesn't treat an STI, the private parts can fall off.
Okay, so what? Just allow me, before I quickly go to the complication, there is something I need to stress about pregnant women. I want to stress it again. Pregnant women, please go for antenatal. Some of you don't want to go for antenatal. In the first trimester, you're like, I'll wait for 6 months and then start going for antenatal. Please go for antenatal and screen. And then we also encourage husbands to escort their what? Their wives. You know, as they screen the woman, they also screen the man. If they are sexually transmitted diseases, you are both treated at the same time, but you also save your unborn what? Child. So going on to the complications. Now, for women, let me start with the women. If we don't treat these sexually transmitted diseases, you're going to keep having inflammation, you know. When you have it the first time, there's acute inflammation, you know that, Sunday. And then when you consistently have these infections, it goes into chronic inflammation. And what does chronic inflammation do? It means that you're going to have scarring. You know, you can have scarring within your reproductive system. You know, within your cervix may be constantly inflamed, your fallopian tubes are constantly inflamed, your ovaries are inflamed, and that affects the production of the ovaries. It's when the fallopian tubes are scarred, a number of women, we can get secondary infertility as a result of long-standing sexually, because when you have a sexually transmitted disease, it can get into a pelvic inflammatory disease, and chronic inflammatory diseases can predispose us to what? To secondary infertility. So because the tubes are scarred, and for some women, you could end up with ectopic pregnancies because the tube is not smooth. As the fertilized ovum is moving, it gets trapped along a strand or along a scar, and then it stays there. You end up with a pregnancy that is in the tube. which is also very risky. So that is one complication. And then for the others, like we talked about the human papilloma viruses, for women, if you don't screen yourself and find out, it can later on, some strains can progress into cancer of the what? They can predispose you to developing cancer of the cervix. Yeah. Then for the men, of course, you have scarring within the what? Within the urethra. That is the most common what? It's the most common complication they have. And as a result, also with time, you find that passing urine does what? Becomes a what? Becomes a problem, because the urethra has been scarred. Then for falling off the penis, I would want to say I don't totally I actually don't agree with it. But what could happen is that, like we said, some strains of the human papilloma virus can predispose you to developing penile cancer. And when you get penile cancer, what do? We have to amputate. We have to amputate. We have to cut that part that probably has been affected. And then issues of other things that come with, there are other risk factors, really. It is not just the infection, but there are other risk factors that could predispose you to that. Yeah, so I think really that's what I can speak to. Yeah, but the key thing I think for women is fertility. Fertility. You reach that time, you're looking for a child, and you have secondary infertility as a result of untreated or poorly treated sexually transmitted diseases.
Please, let's go to the facilities and the managers to prevent these complications, especially for the ladies. Infertility is a key factor. If a man marries and you can't produce, they'll leave you. Okay, doctor, you could give in your conclusion remarks as we conclude the program. Thank you.
As I conclude, from a public health perspective, if we love each other, then we protect each other. If you love yourself, you protect yourself from. So if you're not yet married, please abstain. For those who are married, as married couples, let us protect each other by making sure that we don't go outside our marriages. But above all, let us screen. Let's not wait for symptoms. Let's screen, Screen and see, do I actually have syphilis? Do I have, if there is any change in your discharge, kindly come and get checked. And I want to inform you that we've talked about the culture and sensitivity, the syphilis screening, hepatitis screening, HIV screening. We do all those tests at this facility because for us here, your health is really our priority, and we know that when we have a healthy population, then it is definitely going to be a productive and prosperous population for the nation. Yeah, so thank you very much for having me on this show.
Thank you to Dr. Mercy for giving in your time. The viewers today, we had Dr. Mercy from Oak Diagnostic who took us through STIs. I've been your host, Sunday Junior Tom, together with Sophie behind the camera. Thank you. Till next week on Thursday.